Everyone, I think, will be a little bit worried, or would have been. I'm sure in every house in the country, I know in mine there was kind of a sharp intake of breath when they said 85 new cases of COVID-19 had been confirmed, by far the highest in a long time, in 2 months. Ronan Glynn is the Acting Chief Medical Officer at the Department of Health. Ronan, exactly on that, how worried should listeners be about that increase in case numbers?
So Kieran, I don't think people themselves need to worry unduly. We're keeping a very close eye on the numbers, and the important thing for each of us as individuals is to remember that the power to control this remains with each of us, notwithstanding the 85 cases yesterday. When we hear figures like that, it can be very easy to forget that there are still basic things that we can do that the vast majority of people in this country are continuing to do. But we all need encouragement to continue doing it. This has been going on for 6 months now, and it's completely understandable that people are getting weary and fatigued with it. But if people continue to do the basics, to keep their distance, to limit their time with others, to meet up outside if possible, wash your hands, wear a mask, and of course download the COVID Tracker app. If we all continue to do all those things on a regular basis, then hopefully what we saw yesterday will be a blip rather than a sign of something more significant.
And blips like this, were they inevitable, and will they continue to be inevitable? You know, while there's some virus in the community, will we always have little ups and downs?
Unfortunately, we will. And the key is that we can identify them quickly and clamp down on them quickly. And what we're hoping is, in fact, that the 85 cases yesterday is an indication that our contact tracing system is working well. So with contact tracing, what we're trying to do is to identify cases in clusters very rapidly and then break chains of transmission. But that only works if people put their hands up as soon as they've got symptoms and come forward for testing. And it only works if people isolate as soon as they have those symptoms so they don't spread it on to others.